In this podcast episode, Dr. Bulsiewicz, a world-renowned gastroenterologist, dives deep into the vital role of the gut microbiome in overall health. He explains how disturbances in the gut can lead to serious conditions, including life-threatening infections and even cancer. The conversation also explores the emerging treatments such as fecal transplants, the importance of dietary fiber and fermented foods, the effects of lifestyle choices like alcohol consumption and stress, and how inflammation underpins many chronic diseases. Dr. Bulsiewicz shares practical insights and actionable advice on repairing and maintaining gut health. Dr. Bulsiewicz begins by illustrating the power of the gut microbiome through the example of fecal transplants. A fecal transplant involves transferring stool from a healthy individual into a sick person's colon, typically delivered during a colonoscopy. This practice effectively restores a balanced gut ecosystem. He recounts a patient's ordeal where an antibiotic decimated her gut flora, causing a life-threatening infection with Clostridioides difficile, C. diff. Faced with options of removing the colon or fecal transplant, the latter was chosen. Remarkably, within a day, the infection resolved, underscoring the microbiome's critical role in health. Around 60% of stool weight is microbial matter, emphasizing how the microbes themselves are central to digestion and immune function. Inflammation is identified as a root cause of many health issues, though it often flies under the radar. Chronic low-grade inflammation differs from acute inflammatory responses to injury or infection. It manifests subtly through symptoms such as bloating, fatigue, poor concentration, sleep disturbances, joint pain, and skin problems. These symptoms are frequently ignored or misunderstood in clinical practice. Dr. Bulsiewicz explains that inflammation results when the immune system is persistently activated unnecessarily, causing damage to the body's own tissues. This chronic immune activation often originates in the gut, linked to a breakdown in the gut barrier and microbiome imbalance. The gut barrier, a single-cell epithelial layer lining the intestines, acts as a castle wall that allows nutrient absorption while preventing harmful substances from entering the bloodstream. Healthy gut microbes support this barrier by producing metabolites that nourish it. When the microbiome is damaged, the barrier weakens, leading to leaky gut or increased intestinal permeability. This allows toxins, bacteria, and undigested food particles to cross into the bloodstream, triggering immune activation and inflammation. Fortunately, this gut barrier renews every 3 to 5 days, offering a rapid window for healing when good microbes are restored. Modern lifestyles contribute significantly to microbiome disruption. Antibiotics, commonly used medications that wipe out beneficial microbes, increase the risk of inflammatory bowel diseases and infections. Diet plays a large role, especially the consumption of processed foods, low fiber intake, and exposure to chemicals like glyphosate found on conventionally farmed wheat. Glyphosate disrupts gut bacteria by targeting their metabolic pathways, favoring harmful inflammatory species. This partly explains why some people find they tolerate wheat better in countries where glyphosate is less commonly used, like Italy. The gut microbiome's influence extends to cancer development and treatment. The immune system continuously removes abnormal cells that could turn cancerous. However, chronic inflammation and microbiome imbalance can undermine this surveillance, increasing cancer risk. Dr. Bulsiewicz highlights exciting advances in cancer treatment, particularly melanoma, where immune checkpoint inhibitors wake up the immune system to attack tumors. Patients receiving antibiotics before such treatments fare worse, implicating the microbiome in treatment success. Conversely, fecal transplants from responders to non-responders have markedly improved cancer outcomes, showcasing the essential role of gut bacteria in modulating immune therapy effectiveness. Emerging research links gut health to neurological disorders such as Parkinson's disease. Constipation frequently precedes Parkinson's symptoms by years, and this gut-brain connection shows that the disease likely begins in the digestive tract. Altering the gut microbiome through interventions like fecal transplants has demonstrated durable improvements in movement symptoms and gut function in Parkinson's patients. This challenges the traditional notion that these diseases originate solely in the brain and highlights the therapeutic potential of targeting the gut. While fecal transplants have remarkable potential, Dr. Bulsiewicz stresses that these procedures are clinical interventions, not DIY solutions. There are risks and unknowns, and they should only be performed under medical supervision. The transplant is not a cure-all. Instead, long-term gut health depends on sustainable lifestyle and dietary changes that nurture the microbiome's resilience. The conversation also touches on the growth of pharmaceutical developments aiming to mimic fecal transplant benefits in more controlled ways. Dr. Bullsewicz identifies constipation as the #1 cause of bloating, gas, and related gut discomfort. Poor bowel motility or incomplete bowel movements often trap microbes longer in the colon, where they ferment food residues and produce gas. Frequent passing of small stools can disguise underlying constipation because the bowels are not fully emptied. Diet factors such as excess dairy, lactose, and certain carbohydrates, including fructans in wheat, barley, and rye, can exacerbate gas production due to fermentation by gut bacteria. Fiber deficiency and microbiome imbalance further complicate these symptoms. Contrary to popular belief, true gluten intolerance is rare. Studies show that many symptoms attributed to gluten sensitivity are actually reactions to fructans, a type of prebiotic carbohydrate found in gluten-containing grains. Fermented bread such as sourdough reduces fructan content, explaining why some people tolerate it better. The overall take-home message is that gut symptoms can stem from complex fermentable carbohydrates rather than gluten proteins per se. Fiber is identified as the principal food for beneficial gut bacteria, fueling the production of short-chain fatty acids, SCFAs, like butyrate, acetate, and propionate. These SCFAs are potent anti-inflammatory compounds that maintain the gut barrier and regulate immune responses. Unfortunately, 90 to 95% of people in Western countries consume inadequate fiber, contributing to widespread gut and systemic health issues. Polyphenols, colorful plant compounds found in fruits and vegetables, also support microbiome diversity and function, but require gut bacteria for activation. Fermented foods, rarely consumed in the typical Western diet, have been shown to increase microbial diversity and reduce inflammation even within 8 weeks. Alcohol significantly harms the gut barrier by increasing intestinal permeability, allowing bacterial toxins like lipopolysaccharide (LPS) into the bloodstream and triggering systemic inflammation. Blood levels of LPS track closely with blood alcohol levels after drinking. Chronic alcohol consumption leads to gut microbiome destruction, inflammation, and liver damage, such as cirrhosis. This illustrates a direct gut-liver axis through which lifestyle choices exacerbate disease risk. Dr. Bulsiewicz emphasizes the importance of circadian rhythm, our natural 24-hour internal clock, and how it governs gut function, immune activity, and microbiome cycles. Key levers for enhancing circadian health include consistent wake times, morning exposure to sunlight or bright light, light exercise upon waking, hydration, especially with water and prebiotic fiber, and timed meals spaced about 4 hours apart. Morning light and movement boost cortisol naturally, improving focus and metabolic regulation, while evening light reduction supports melatonin production and restful sleep. He advocates for time-restricted eating with a fasting period of approximately 14 hours overnight to allow gut rest. The podcast highlights that the gut microbiome largely forms by age 3 and strongly influences immune system development. Early life factors such as antibiotic exposure, C-section birth, and bottle feeding can negatively imprint on microbiome diversity and increase risks of allergies, autoimmune diseases, and metabolic disorders. Breastfeeding contributes beneficial microbes and diverse human milk oligosaccharides, HMOs, specialized prebiotics unique to breast milk that foster healthy microbial colonization. A profound discussion centers on how psychological trauma and chronic stress activate the sympathetic nervous system, releasing hormones like corticotropin-releasing hormone, CRH, that impair gut motility, barrier integrity, and balance immune function. The brain-gut axis explains how mental and emotional health are intertwined with digestive health. Trauma rewires the brain, particularly the amygdala, keeping individuals in a perpetual fight-or-flight state harmful to the gut. Healing begins with acknowledging trauma and seeking professional counseling or therapies to resolve it, reinforcing the holistic nature of gut health. The Bristol stool chart is explained as a tool for identifying healthy bowel movements, type 4, versus signs of constipation, types 1 and 2, and diarrhea, types 6 and 7. Dr. Bulsiewicz explains that fiber alone is often not enough to resolve constipation. Magnesium supplements, especially magnesium oxide or citrate, are useful to soften stools by drawing water into the intestines. Sleep, hydration, and consistent meal timing also support bowel regularity. Turmeric contains curcumin, a polyphenol with potent anti-inflammatory effects by blocking specific inflammatory cytokines, immune signaling molecules. While turmeric supplements can be beneficial, excessive intake may cause adverse effects, so dosage should be managed carefully. Many colorful plant foods contain polyphenols that contribute to gut and systemic health via microbiome interactions. Dr. Bulsiewicz advocates for a balanced, whole foods-based diet inclusive of 4 nutritional pillars missing from most Western diets: fiber, polyphenols, healthy fats, such as monounsaturated fats from avocados and olive oil, and omega-3 fatty acids, and fermented foods. He underscores that dietary patterns like Mediterranean, pescatarian, or flexitarian, when done correctly, encompass these elements. Extreme or highly restrictive diets, e.g., all meat or all fruit, are discouraged as neither optimal nor sustainable. Beyond dietary and lifestyle changes, Dr. Bulsiewicz shares his personal story of healing relationships within his family, especially reconnecting with his estranged father. He reflects on how forgiveness and emotional healing were critical parts of his well-being transformation alongside improving diet and exercise. The role of love, connection, and purpose, especially following the birth of his daughter, provided profound motivation and insight into the importance of relationships for health. To support people further, Dr. Bullsewicz is launching a YouTube channel and has a website where he shares the latest gut health science and practical advice. He offers a free newsletter for ongoing education and a comprehensive new book that distills his decades of clinical experience into accessible, evidence-based guidance for diverse readers seeking to optimize gut and overall health.